Welcome back to part 2 in this video series. For those of you who didn't see the last video, my name is Emma Gatehouse and I'm the Behaviour Resident here at Langford Vets. In this video I'm going to talk about the effect that stress can have on physical pathology and explore some specific effects on different body systems. The presence of stressors directly affects the physical and behavioural health of our patients. Whilst we often consider stressors to be external, such as behavioural triggers like a dog seeing a neighbour that they really don't like, we also need to consider that a stressor could be internal, such as an ongoing disease process. Either way, in the presence of a stressor, we see neural activation with stimulation of the amygdala, cortex, and hypothalamic pituitary adrenal axis, HPA axis. In turn, we see a cascade of products including cortisol and inflammatory mediators increasing. We then see a variety of outward behavioural presentations, such as increased reactivity and vigilance. It is important that we recognise both the behavioural outcome and the process which leads to it, in order to understand why behavioural changes may occur as a result of physiological disease or increased internal stresses. With persistent stress, we see prolonged activation of the HPA axis through stimulation of the adrenal glands to produce additional cortisol, which leads to dysregulation of the feedback loop, which would normally turn off cortisol production. This prolonged cortisol elevation leads to immune suppression, metabolic effects such as weight changes, and neurochemical imbalances. Eventually, as the adrenals and pituitary become further disrupted, there resulted hormone production due to neuroendocrine exhaustion. Over time, there are significant changes to the sensitivity of the limbic system, the amygdala and the hippocampus, with increased baseline anxiety and persistent reactivity despite the absence of triggers. We also need to consider the role of the amygdala in our emotional responses and how this can be affected by chronic stress. The amygdala is responsible for evaluating sensory inputs for potential danger and associating these experiences with emotional significance. Corticotropin-releasing hormone, an important part of the HPA axis, has a direct effect on the amygdala, increasing its activation. Therefore, in chronic stress responses, the amygdala becomes overactivated, leading to heightened emotional reactivity. Persistent exposure to these stressors, physical or behavioural, can therefore lead to disproportionate reactivity, as inhibitory control from the hippocampus reduces and the amygdala becomes hypersensitive to stress. The hippocampus is responsible for memory formation and helping animals to determine safe or dangerous contexts. The hippocampus usually provides inhibitory feedback to the HPA axis, helping to control the stress response. Prolonged stress leads to hippocampal atrophy and functional impairments whereby the hippocampus's ability to inhibit the HPA axis is weakened, allowing continuation of the stress response. Impaired learning and memory consolidation makes behavioural modification harder, and animals may struggle to distinguish safe and unsafe contexts, leading to generalised anxiety. If we consider wider non-neurological effects of chronic stress, then we also need to consider the effect on specific body systems. The effect of stress on the urinary tract is important to consider, as this is one of the main presentations you may see in primary practice. Stress and dysregulation of the HPA axis can have significant direct and indirect effects on the bladder. If we consider, for example, feline idiopathic cystitis, both bladder changes, such as inflammation of the bladder lining and increased permeability, increase the sensitivity of the bladder, whilst noradrenaline release can lead to reduced blood flow and increased bladder tone. Therefore, whilst treating the cystitis signs, the internal stresses, we should also modify the cat's environment and consider the presence of any external stresses to improve clinical outcomes. MIMO, which stands for Multimodal Environmental Modification, guidelines can support caregivers to do this. Another significant body system that stress affects is the gut. Signs such as a change in gut transit time, nausea, vomiting, and changes in eating habits can all arise as a result. Cortisol increases intestinal permeability by reducing mucosal integrity and suppresses gut immune functions, as well as altering the composition of the microbiota. Adrenaline causes vasoconstriction, causing reduced blood flow to the GI tract and causing further motility changes. Sympathetic activation overrides parasympathetic pathways via the vagal nerve, further affecting gut motility. We need to consider ways in which we can support our patients with different feeding methods and adjustments in feeding routines to help them alleviate symptoms whilst managing gastrointestinal disease. Finally, I want to touch on the effects that stress can have on the skin and consider how we may see dermatological changes as a result of excess HPA activation. As discussed in the other body systems, catecholamine release can have a negative effect. in this case on the skin barrier and immune suppression. A range of other compounds, such as cytokines, are increased in stress responses, and these can have a direct pro-inflammatory effect. We have to consider how behaviour concerns that may occur can also impact the skin, such as self-soothing behaviours and anxiety, or compulsive behaviours where physical trauma is done to the skin. Managing exposure to stressors and supporting animals through behavioural modification programmes is essential alongside conventional treatment in these cases. That is all for this video, and in the next video we will focus on pain, cognitive decline, and later on in the series we will touch on some more specific disease processes.